Hey guys, welcome once again to the Doctor. I'm Dr. SK Ratemo, and today we talk about febrile convulsions. Now, before we continue, we need to define a few terms. What is a convulsion and what is a seizure? Now, the difference between a seizure and a convulsion is very small. A seizure is what happens in the brain when we have a sudden jerk in electrical activity of the brain. Now, a convulsion is what you visualize physically. It may range from jerking of a single arm or the whole body, or a change in behavior or feeling, and sometimes it can lead to change in the level of consciousness. So when we say febrile convulsions, this is what happens when a child has a fever, from the word itself, febrile, which means these convulsions occur in children when they have a fever. What causes the febrile convulsions? We have infections like acute tonsillitis, which is a bacterial infection which can lead to spiking of the fever in a child, and they will lead to a febrile convulsion. The reason as to why we are going to speak about these convulsions is that they are common in the pediatric population, and unfortunately most parents are not aware. So when this happens, you find that most parents become very terrified. But as we shall see, these seizures or convulsions are benign and do not signify a serious thing in your child's health. Now we need to know how it presents. But before we define how it presents, we need to know that we have two types of febrile seizures. We have a simple febrile seizure and a complex febrile seizure. The difference comes from the time, the duration when your baby has this seizure. And remember, as I said earlier, your child can have jerking of muscles all over. Your child can just have a fixed staring at one place or lose consciousness. So for simple seizures, they do not occur more than 15 minutes and they do not recur in a period of 24 hours. Then compared to the complex seizures, for the complex seizures, it can occur for a period or duration of more than 15 minutes and can recur more than once in a period of 24 hours. Before we continue, we need to know that we have some risk factors that predispose some children more to getting the febrile seizures. One of them being, if your child gets a febrile seizure with a low-grade fever, that ranges from 37.5 to 38 degrees Celsius. And also as a parent, if you ever had a history of a febrile seizure as a child, then your child has a high likelihood of having a febrile seizure. When this happens, your child is getting a febrile seizure at home, what are some of the measures that you need to take before you take your child to the hospital? One, remember, as we have said, this seizure is caused by a high body temperature or a fever. So the first thing you need to do is that you need to make ways of lowering the body temperature of your child. One of them is by removing the clothes of the child and exposing the child in the open air. And also you can use sponges to wipe the forehead of your baby. If your baby continues to have the seizure, then you need to call an ambulance so that the baby is taken to hospital. And in the hospital, we can do several things. One of them being we can give a drug that stops the seizure, especially if it has gone more than 5 minutes. And the drug that is commonly used is diazepam, which can be given through intravenous route, or it can be given parectally to control the seizures. But remember, this is just to control the seizures, but not to prevent them. So the ultimate goal of treating febrile seizures is by treating the underlying infection. Now that we have seen how the febrile seizure presents and the management, you need to take the following precautions at home. If you see your child is less active than normal, less playful, or having a cough, that might be a sign of an infection. So at home you should have at least a thermometer to be taking your child's temperature. And also remember, when this happens, and especially if the febrile seizure goes more than 5 minutes, please seek medical advice immediately. Thank you for listening. This is Dr. Ratemo in the Doctor. See you in the next video.